So I think the iPCI is a special conference of its kind because it essentially showcases what imaging and physiology have brought to the world of coronary intervention. It teaches all of us about the importance of physiology, when to actually decide that a lesion is significant or otherwise, and the imaging part is has now entered every aspect of coronary intervention. Earlier, it was just for optimization, but now it's also for deciding what kind of preparation needs to be done, what sizes of interventional devices that we need, and how to go about finishing the procedure, how to go about optimizing the procedure, how to follow up. And in case somebody comes with a stent failure, to actually figure out what is the reason for that stent failure and to correct it in the best fashion possible. It offers an opportunity for global experts to come and interact with all levels of seniority of interventional cardiologists. And the exchange of ideas always benefits both sides. The world gets to see what kind of work we are doing, and we get to see the cutting edge technology and what's the next step as far as the field of imaging and physiology is concerned. I think it's an extremely well attended and well designed conference, and looking forward to the next 2 days for more updates.
సార్ ఈరోజు చాలా మంది డాక్టర్స్ ఇక్కడ కలవడం జరిగింది, లైవ్ కాన్ఫరెన్స్ కూడా జరిగింది. సో వాళ్ళు మీతో షేర్ చేసుకున్న మూమెంట్స్ ఏమైనా ఉన్నాయి ఇక్కడ, అంటే కొత్తగా నేర్చుకున్నాను.
ఓ కొత్తగా నేర్చుకునేవి చాలా తెలుగులో మాట్లాడమంటారా? So there are plenty. What he asked was moments. I mean, it's a privilege to be able to share with Indian experts like Ronnie Matthew and Dr. Ajit Mulaseri and Dr. Chedda, etc. There are lots of things we learned about imaging and about near Hybiz from Dr. Chedda, and about physiology from our other colleagues, Dr. Rajesh and Dr. Hari Krishnan, and also from the international experts from Dr. Julio and Dr. Ziad about the newer types of imaging that are coming in, the next generation of OCT catheter which is coming in, and what new it is going to do and what more we can achieve with what we've already got.